morning to Elizabeth Koff, the Secretary of the Department of Health in New South Wales, the Queen of the frontline staff, all of your amazing team. Welcome to Western Sydney Unfiltered, Elizabeth.
Thank you very much, Chris, and I'm delighted to be here. And I know I've spoken at some previous Western Sydney leadership dialogues, and I'm delighted to participate once again.
And you are, as I mentioned earlier, the best dressed person we've had in the series so far. That resplendent in hot pink. So thank you for a person who hasn't got to work at home like most of the rest of the community for the past few months. I know you've been office bound the entire time, so you haven't got into that leisure wear.
No.
The rest of everybody has adopted. So talking about, we'll make light of it now, but you've just been through and are still going through. We tend to think we're not still in it, going through the most amazing professional experience, tinged with personal tragedy and possibly also professional highs. I mean, there's a tragic period. It's also been an amazing time. Maybe the early learnings. What have you learned on the way through as you've watched your teams battle both? The public perception matching public health as well as actual service delivery?
Look, from our perspective, the response to COVID-19, it was a real roller coaster is the best way I can describe it. And it was a roller coaster mainly for a number of reasons. Number one, this is a once-in-a-100-year pandemic that hit us. And there's no rule books on how to manage pandemics.
You looked for one, I'm sure, and there wasn't a manual there. So your predecessor hadn't left you some notes.
No, that's it. You can usually stand on the shoulders of those that go before you to develop your response. And whilst we had pandemic plans that were largely based on theory and clinical evidence, the practicality of managing the pandemic was something that none of us had ever done before. And
how much note swapping did you do around your state colleagues? Was there an opportunity to network the concept within Australia?
So we were very fortunate, and most of you will have seen our Chief Health Officer, Dr. Kerry Chant.
She's become a household name.
She certainly has, a remarkable woman, and she was the expert clinical advisor on public health. So she provided the advice here within New South Wales Health and to the New South Wales government. And I think that's what's added a layer of complexity to the whole management of the thing, that it was a whole of government response that had to be initiated to respond to it. It wasn't just health attempting to manage everything, thank goodness, by ourselves. And the liaison with other states and territories was significant because the initiation of the National Cabinet, as people were well aware, I think was quite a remarkable endeavour to get the country and everyone on board to say consistency and standards in how it's managed. And our liaison with other states and territories was absolutely critical, I believe, because we asked advice. As I said, there was no rule book, no guidebook. So we'd often pick up the phone and say, what are you doing about testing levels? How many testing clinics have you got? Have you got drive-through COVID testing clinics? All those things that were rapid response that needed to be done, we were sharing the information and the data and the activities all across the country, which I think why the Australian response has been so highly regarded.
That level of collaboration must have been inspired by the newfound collaboration amongst your local health districts in Western Sydney that traditionally might always have had a little competitive tinge at the edge. In recent times, there seems to be a real together. They're really, and maybe inspired by this as well, to come together, the three that span our region.
That was one thing that was so remarkable in managing this. Traditional barriers really dropped immediately, and I can say that from the perspective of dealing with other clusters in government, with the districts dealing with each other, even with health agencies dealing with each other. Any sort of competitiveness really disappeared overnight because people were all focused on the common good. And one area I think that was really demonstrated was in data and information sharing. We needed to disseminate and distribute case identification. I often say to people, people look at the numbers in the next day, and I think they have no understanding of what sits behind both the collation of those numbers, the testing of the cases. 15,000 pathology tests a day on some days. And as the head of pathology said to me, a negative test is just as much work as a positive test.
It's more than your standard Douglas Hanley Moyer sort of workload for a day.
That's right. So on some days we've churned through 16,000 tests. And when you think somebody has to swab the test, somebody has to, gear up to take the test, somebody needs to send it to pathology.
And that got better as you went on. I mean, I know myself, other people in my office, some people were waiting a week or more at the front end to get results. So you must have somehow found the capacity to greatly ramp that up, because it wasn't real flash right at the beginning. The time was...
No. And that's what was so remarkable, the innovations that occurred. So traditionally, if you remember, when you have a pathology test, normally you get the test, it goes off to pathology, the test result goes back to your doctor, you wait a couple of days till you can go and see your doctor, or go back to the emergency department, or go back to the hospital. And in this instance, we said, this can't work. So the brains at New South Wales Pathology said, let's have a text message response if you're a negative case.
So what have you learned for the whole system then? We've, in massive change, massive transformation, we've all been through in our businesses. Guess what? We went online within 2 days, and we're now doing our boardroom events online, and we're interviewing, and we all made change. How come we couldn't make that speed of change before? Does it require a crisis to enable human resource changes, innovation funding, whatever? Or in future, will we be more agile and mobile anyway, because we've sort of broken the back of old processes?
We've been working on what future health strategy looks like, and what we call virtual healthcare is really the next frontier in healthcare. In some instances, hands-on care. Somebody says to me, healthcare is a contact sport, which it is, but for the future on some things, when you consider the time and investment in travel, attendance, waiting for appointments, etc. So with appointments and chronic disease home monitoring, we really accelerated the response to that. And it was largely driven out of safety of patients with chronic disease coming to visit us, and safety for our staff. Because with the invisibility of the virus out there, you needed to be confident that you weren't exposing staff to any risk, or minimise the risk. So what we call virtual healthcare accelerated overnight, and our meetings within the health system, we went up to 1,000% increase in virtual meetings such as we're having now, and I'm sure it was no different in many other businesses.
Is there something, and I don't know if you thought about it this way, is there something in relation to the female leadership dominance in health? I mean, in Western Sydney, we have 2 of the 3 districts managed by female chief executives, 2 of the hospitals, the head of health infrastructure, the head of the Department of Health, with due respect to Minister Hazzard. I mean, it's a female-friendly, female-led sector, and a debate now where all of the stimulus appears to be in blokey industries. There must be something about that you've looked through this process of the sort of female leadership teams dominated, and what you've learnt from that.
Look, I think critically we're always conscious of gender diversity in roles. And
you do let some blokes into health leadership, do you?
Yes, our executive team here at the ministry is an equal mix of 3 males and 3 females. So I am leading the trend with the other clusters. But if you look historically at what the leadership is, we've got an honour board here in the ministry. It was all male till about the last 3 or 4. So
they caused the pandemic, and the ladies brought us through. It's fantastic. Yeah. It's a great outcome.
But look, I think it's the collective skills of a team that come to the fore in this sort of situation. And as I said, I was just really delighted the way everybody just stepped in. And in one sense too, one thing that was quite a shift for us, we had to go into command and control. And that's a place where we don't traditionally operate in health unless it's life and death. At the bedside, command and control is alive and well, because you want doctors to make clinical decisions. But normally in the management of healthcare services, we consult, we engage, we get consumer or patient perspectives, we engage clinicians, and how do we work through something? Overnight, we had to just say, this is what we're doing, this is what will happen, and this is what needs to happen, because we were dealing with the crisis.
Let's look at a Western Sydney focus. We've got a large amount of activity of construction across the region. We've got an European hospital being upgraded at Westmead. Blacktown's almost done. Bankstown's planned for this magnificent new downtown hospital. Campbelltown's building stage 2 and hopeful for stage 3. Liverpool's going to go massive increase. It's an enormous infrastructure push, and there's others, but that's a good starting point. We're also seeing off the back of that the development of these health and education precincts where the universities are coming on board and associated ancillary, someplace schools, TAFE and other things being part of the mix. A genuine, when we're involved in running the CHEP, I keep saying California, the Campbelltown Health and Education Precinct. There's the LIP in Liverpool, the WEP in Westmead, etc., and others, clusters around Penrith and Blacktown. Are you confident in the long term? I know you have a view that, well, it's great to build new hospitals. In the perfect world, we wouldn't need them. We've got to find ways to reduce the need to build more infrastructure and provide more healthcare. Are you confident, though, that dissemination of health and education going forward leads to breakthroughs in medical research and development of a broader health industry and service industry jobs?
Look, I think it's absolutely critical, and we're in a very privileged position as far as the government allocations for development of health infrastructure across the whole state. My desire, and part of the conversation that we've been having, we need to leverage this investment by government to make them of economic benefit to the state too, and to then enhance the clinical care and the research and the education that we provide. So we have to stop looking at them as infrastructure projects, number one. Let's do the bigger thinking about how these precincts are part of a much broader community. And health has, unfortunately, traditionally been quite isolationist. The hospital is the hospital and what goes on outside it. But as we've seen at the Westmead precinct, the interface with transport, the interface with other industries that proximate to it, how we start industry attraction by having greater clarity around what the role and function of the precinct is, how we bring on university partners, that all has economic benefits that we need to realise. And the only way we'll realise them is by developing trusted relationships and partners with business and industry and tertiary facilities around these entities. And in my mind, it's an enormous potential. And that's the conversation we're having with government at the moment in terms of their stimulus packages post-COVID. How do we leverage the significant investment to really then have the amplifying effect of stimulus to the broader economy rather than just being a hospital? Not that a hospital's not important.
And in Western Sydney, the sheer amount of development, and I'm delighted the way the community, your education partners, local government particularly, has embraced those developments and are thinking of ways to make them the type of knowledge clusters they can be, the generating job factories they need to be as well as an economy changes. Just in closing, I suppose it was a mix of somewhat luck and mostly good management that a nation's come through with only 102 deaths from COVID-19 so far. And if you take out 3 of the big clusters, almost very small community transmission based on successful public health practices and policing practices and community acceptance. But we had the tragic experience recently with some of our members of the dialogue to have an online forum with Alwyn Williams, the CEO of the Barts NHS in London, in East London, who we visited last year on our tour to East London, where the Royal London Hospital's lost 600 people at that hospital, and they've lost 10 or 12 nurses and doctors at the hospital, etc. That must, and I don't want Australians and Western Sydney to think that we just got lucky and we got through this, sort of to forget the ramifications of what still could be and what has been in very like-minded regions. East London is not the third world. This is a similar geographic cousin to Western Sydney. So you must be proud of the achievement of you and all of your health professionals, from the frontline staff to head office, to help get us through this.
Look, it's extraordinary, and it can't be underestimated. And this is what I talk about, the roller coaster ride of managing this at the outset, because clinicians are actually a very tight-knit network internationally. They look at what's happening in other health services. So, first of all, what happened in Italy really started to make them very, very anxious. And obviously what happened in the UK within the NHS really started to filter back, and there was a sense of fear and foreboding that if what happens to us as what happened to them occurs, we will be in the deepest of trouble. And there's no guarantees either, because that's one of the hardest things. You're managing something invisible. You can't see it, you can't feel it, you can't touch it. It's not like the bushfires were something, roaring down the hill.
Let's hope all that investment we're putting in health education precincts across Western Sydney, next time the ugly black swan does waddle into town, let's hope that the scientists and innovators and educators and practitioners housed in those great knowledge hubs will be part of the solution in future, that we can discover the vaccines, we can work on the remedies, we can get ahead of this another way. Elizabeth, I usually end most of these interviews by asking people, what they've been watching on Netflix in lockdown, but I know you haven't had that luxury. And most people in health, what's Netflix, they say, working 15 hours a day in the office, and didn't get to understand athleisure wear or a good series on TV. So when you, hopefully in the near future, as hopefully we're through the worst of this, you get a bit of time to relax and
thank you, Chris.
Tune into the odd program or two. Please pass on to all of your staff our deepest respect and affection for the work they've done.
Thank you very much, and delighted to talk to you and the dialogue. Thanks,
Elizabeth.